My name is Dr. Randy Lavispear. I'm currently the Medical Director at Angola State Penitentiary. The following is a short, simplified update on the coronavirus. The coronavirus is a respiratory virus first reported in China as of December of 2019. The disease caused by the coronavirus is COVID-19. This is a pandemic. A pandemic is associated with concerns over the geographical spread of a disease and is declared when a new disease for which there is no protections spreads around the world beyond expectations. A pandemic has nothing to do with panicking. There are three ways the coronavirus can enter your body: your eyes, your nose, and your mouth. The coronavirus is spread from person to person through respiratory droplets produced when coughing and or sneezing. People within 6 feet of an individual are at risk for being exposed to these droplets. Also, research has shown that the coronavirus can live on hard surfaces for hours to days. This means if an infected person sneezes or coughs onto a surface such as a countertop or a doorknob, and another person touches that surface, then rubs his eyes, nose, or mouth, they may become infected. The most common symptoms of COVID-19 include fever greater than 100 degrees, cough, and shortness of breath. However, in some cases, the illness may cause body aches and sore throat. Importantly, the large majority of individuals who become infected appear to have mild symptoms and may not even know they are sick. In more severe cases, COVID-19 can lead to pneumonia, kidney failure, and even death. The elderly with underlying medical problems such as heart disease, diabetes, lung disease, HIV, cancer, and those taking drugs that lower their immune system are the population most likely to contract the disease and have complications. It must be noted, no age group is exempt from contracting the disease. The coronavirus has an incubation period of 2 to 14 days. This means that it may take 2 to 14 days from when a person is infected until they show symptoms. The average time from infection to showing symptoms is around 5 days. To protect yourself from the coronavirus, wash your hands frequently with soap and water. Make sure to wash your hands for at least 20 seconds. Sneeze or cough into your folded arm or a tissue and immediately discard the tissue after use. Avoid touching your eyes, nose, and mouth with unwashed and unclean hands. Clean and disinfect surfaces and objects that are normally touched, like doorknobs, countertops, desks, phones, keyboards, toilets, faucets, and sinks. Do not congregate in large groups. Limit those groups to less than 10 people. Do not share eating utensils, soft drinks, cigarettes, inhalers, or towels. The best way to prevent the spread of COVID-19 is to keep the sick people separated from the healthy people. You may see in your facility the process whereby the population that are at high risk for contracting the coronavirus are isolated from the rest of the offenders. This isolation is an attempt to limit the exposure of those high-risk individuals to the virus. Being placed in isolation is not a punishment. It is for your own protection. As far as wearing a mask is concerned, if you are not sick, you do not need to wear a face mask unless you are caring for someone who is sick. If you are not able to wear a face mask because of breathing problems, then you should do your best to cover your coughs and sneezes. If you are sick, seek out medical attention immediately. Your need for appropriate housing, isolation, and placement of a mask will be determined by your healthcare provider. Currently, there are no vaccines to prevent the coronavirus, and there are no approved medications to treat the virus. All treatment is supportive in origin. Finally, the best way to prevent illness is to avoid exposure to the virus. Take all necessary precautions as described. Be smart and do not panic. From a correctional facility standpoint, we are prepared to address this current issue with coronavirus. We're asking for your help. Take all necessary preventative precautions as previously described. Again, be smart and do not panic. We will get through this crisis by communicating and working together. Thank you.